Okay, so good morning. This is Nurse MJ Kabyok, and I graduated with my master's in 2013, and I am currently studying with my doctorate degree. And my doctorate degree as of the moment is doctorate of management technology, and maybe next year I would already shift or transfer to a university with doctorate of nursing, major in geriatric nursing. So I have been a nurse for 10 years now. I became a registered nurse last March 11, 2011. So more or less 9 years. Okay. So I first worked in my 9 years in this industry. I first worked as a writer in the Eastern Visayas Mail, and then I only lasted for 1 month because there are just constraints or life threats when you write for difficult topics, such as ambush. So I did not last in the job. And then after which, I already began my R in Hills experience for 1 year. That was 2012 to 2013. And at that time, I was only earning 8,000 pesos a month, and the salary was even delayed for 3 months. Okay, so you can just imagine how hard it was to be serving in the far-flung barangays or far-flung areas, and there are moments when we do not have service, when I had to experience um, riding a jeepney at the bottom or at the um, last part of the jeepney, and I almost fell. There were even times when I had to ride a habal-habal, and um, I had to carry cool dogs vaccines just to be able to serve the Filipino people. And after which, since our contract, we were not allowed to renew at that time, so I had a 2 year work contract as a part-time nurse in a private school, and I lasted for 2 years, and I was earning um, 3,600 pesos per month because I was part-time and I had to work 12 days per month. Okay, but um, at that time I had to work like a full time. Okay, I had to carry the responsibilities of a school nurse full time. So I had to do lectures, health teachings from elementary to fourth year high school students, at the same time um, teach health subjects, and every time I teach health subjects I was earning 30 pesos, no, per subject. Okay, so there was just an additional 30 pesos on my salary. Okay, so I had no PhilHealth at the time. I had no SSS. So um, after that 2 year experience, I just had to gather 3 years of nursing experience, and then I already applied as a clinical instructor in the Visayas State University, and I had a 1 year stint there. Okay, so for 1 year or for 2 semesters, I had to work with VSU College of Nursing, and then I was earning 17,000 at that time. Still no PhilHealth and no other benefits except that you have your 17,000 salary, and I was teaching from first year to fourth year. Okay, so I had gathered experiences from medical ward, surgical ward, dialysis unit, community health or CHN nursing experience, and it was a good year in my career, as I had to um, as I have experienced, starting to really earn um, big bucks of money. So, from 8,000, naging 3,600, tapos naging 17,000. But still, I was not that satisfied because it pertains hard work. You work in the morning shift, you work in the afternoon shift, you work in the evening shift. Okay? So, I had to study German language, and then while studying in Cebu, I had to work as a reliever nurse in companies, and I was earning 600 pesos a day. And then when you are a freelancer as a nurse, so you can hop from one company to the other. And during that time, if there was no available nurse on duty, the bidding would be as high as 1,000 per night, no? So that's also the advantage of those nurses working as part-time in company setup. And then after which, that experience was, it has made me grow from novice, no, to beginner, and then advanced beginner, okay? And that was the time when I had experienced a clinic with full facilities, with modern gadgets to take the vital signs. We have complete medicines, we have complete amenities, we have a comfortable clinic, we have vaccines for employees, we had a good program in the company. And then still, because um, there was no regular position available, because there's only one company nurse, no, in every company. Okay, so I I was enticed, or I was encouraged to join the workforce, and I became a voice talent. Okay, so I became, they call it a call center agent, but we call it a nurse associate or a medical specialist. So you talk to American nurses and doctors and also patients, and you explain to them the medications. So our role was still as a nurse on the phone, but at that time I was already earning 27,000 per month. And then on my next company, I was earning 31,000 per month. And then my latest company was a medical health insurance, and that was the time when I had to experience telenursing or telecommunication, on which I would be talking to different nurses in the entire states, and as well as work with doctors with the patient's therapies. We will be the one to record their admission, so their insurance would pay the hospital, the network hospital where they are admitted. And we have behavioral, medical, and also we cater geriatric people who were insured. So from novice to expert, I really had 8 years to grow in the industry. And it was a good experience for me, although it was hard. There were ups and downs, but it has led me um, to more competitive, and to more job opportunities, no, not only in the Philippines. So right now I am a clinical instructor at the Doña Remedios Trinidad Romualdez Medical Foundation College of Nursing, and I was hired as an instructor 6, and with full time commitment, or with full load. So right now I'm earning quite a bit as compared to my previous job, because when you are a clinical instructor, you will be paid per hour. And that's why also I am taking up my doctorate degree and I am really planning, to be a geriatric nurse expert. Okay, so um, when it comes to my experiences, okay, if I had to compare my first day experience when I worked as a professional nurse and how will I be evaluating my expertise and competencies today, I can say that I can already face, a full-time duty, a full load duty, with students, supervising students with me, because when I started as an RN Hills nurse, my job description was a supervisor supervising um, the community health team, with the program of health. Okay, so compared before, at least now, after 8 to 9 years, I'm already um, patient. No, I already gained patience in handling people. So when you are already and when you are already in the industry for 10 years, you're almost an expert level, you will learn to be proficient on which your focus is how to handle your manpower. Okay? So you already know the basics from novice to advanced beginner, what to do when there are emergent situations. But since my master's as well was about nursing service administration, I was really born to, if we will follow the career ladder, I was born to become um, a chief nurse, no? So that's the equivalent position with our academic profile. Okay, so as a nurse, I think 8 years was enough, and if I will go abroad, I already have an enough um, strength to go abroad. In I already gained, a lot of experiences from hypertension to a lot of case scenarios. So there's a lot of things to teach, pathophysiology, definition of terms. Um, there's just a lot. So um, today, compared to my first day, I'm I can say that I'm already competent now, because experience is gained through the years, and experience will also come with time. So as compared to my first days as a nurse, where I get rattled, I didn't have that much confidence in handling patients, in handling students, in handling um, pediatric clients. Okay, so the advantage with my first exposure as an RN heals is that I was able to experience vaccinating a lot of um, a lot of children, no, and given, the public health scenario, or the public service, where we really have to take care of 60 um, babies, to vaccinate 60 babies per day. That was a more than enough experience to really gain knowledge and hands-on experience to teach others. Okay, so um, I still have so many years to learn, but in my 8 to 9 years in the industry, I think I had enough in 10 years, and I am ready to level up into another specialty, which is the geriatric nursing expertise. So, syempre, before, medyo mahirap. It was really difficult. I think most nurses would really attest that there's a certain difficulty. But right now, I have already enjoyed together with my working experience, I can say that, you know, I have grown, my salary as well have grown, my experience have grown. Okay, so that was that will be my answer for number two. When it comes to Dreyfus model, um, because we would be starting from beginner, advanced. We will be starting from being a novice, and then advanced nurse practitioner, and then proficient nurse, and then the last would be the um, being an expert. So that was my experience. So when it comes to the Dreyfus model, it takes years really to build confidence in this job or in this work. And when it comes to the pressing issue, okay, that nursing is facing today, um, I have several answers to that. Okay, so we have work environment. Okay, so we all know that 2020 is the year of the nurse, knowing that there is a pandemic, the COVID-19 pandemic, okay, that has put the lives of nurses to a high risk. And these are some of the problems that we really encounter in the ward. Okay, number one is the work environment, no? Sometimes, you know, they call it toxic environment. Sometimes work environment, especially in the Philippines, is unhealthy. Okay, so we have schedules, we have breaks, we have workflow, we have on call and overtime expectations. So, if you are a subordinate or if you are a novice nurse, you will have a difficult um, time to adjust, especially if we have lack of manpower, you know, which is really evident in our time today in the Philippines. We are lacking of manpower who will go on duty on the AM shift, on the PM shift, and on the night shift. And we have a lot of patients to deal with, not only COVID-19 patients. So we have the cardiac patients, we have the um, kidney patients for dialysis, we have the maternal patients, we have pediatric patients, so on and so forth. Okay, so we also have a problem with autonomy because in the Philippines, most nurse practitioners can only practice independently when they have their own clinics, which are birthing clinics. But we have not yet practiced those nurses who can really administer medications and who can also prescribe medications. In the US or in Europe, there are nurses who acts like a doctor. Okay, so if you will watch the series Virgin River, Nurse Mel there, nurses abroad or nurses in the US specifically, they function like a doctor. So we have nurse anesthetists abroad. In the Philippines, most of our anesthesiologists are doctors. So we have to remember that nurses and doctors are two separate entities. Although we are colleagues, but we have different roles in terms of taking care of a patient. And then also another problem is most nurses doesn't have hazard pay. Um, their lives are being put to risk, but sad to say there is no hazard pay for most. If there are only the government employees or only the um, NDPs have hazard pay. Okay, some hospitals are practicing hazard pay, but it is not really clear to us how much is their hazard pay. Okay, so unlike in the Department of Health, if they will decide that all NDPs will get a hazard pay, then they will get a hazard pay. But sometimes those hospitals which is being manned or which is being governed by the local government unit, there are no hazard pay for most. Okay, and the nurses' safety. Sometimes our PPEs are only being our PPEs are being recycled so as to be efficient and so as to protect our nurses. But ideally, okay, that should not be recycled. But since we have a lack of supplies as well, so we have no choice but to improvise and reuse our uniforms or reuse the PPEs. Okay, and remember that the virus is very virulent. Okay, and then we also have a problem with hours of work. For example, United Kingdom, they only follow 37.5 working hours per week. But in the Philippines, sometimes you have to really work 40 hours. Okay, if it is um, 5 times per week times 8 hours, that's 40 hours per week. Okay, and then we also have a problem with economic aspect. Salaries, no, um, salaries is not yet that competitive. Basically, in big hospitals, good if you will start earning 12,000 pesos, 15,000 pesos, 16,000 pesos. That's already a monthly salary. And economically, that is not a good thing to receive, because that is an exploitation to the profession. And we are expecting competitive salaries in terms of our responsibilities also as a nurse. But sad to say, nurses as of this moment are not yet well paid. Wherever you go, either in Cebu, in Leyte, in Bohol, um, you can only count in your um, hands if um, if these nurses are earning 20,000 basic. Okay, so that's also a problem. And then job satisfaction, that's a problem that we are facing today, because after this pandemic, most nurses again, would be hired abroad, and most Filipino nurses will really fly. Okay, so most nurses would be um, they would choose to fly or to serve other countries. And the problem is they don't have the intention to remain, because the salary abroad is bigger than what we have here. Okay, so those are some of the things that those are factors why our nurses are not staying. So there are so many problems in the nursing profession, but I guess I have already said quite a lot. So I would like to um, take this opportunity to greet and then thank my colleagues in the University of Bohol for this for the job that they are doing um, in RTRMF College of Nursing as well. We have been doing our best to um, train our students with excellence, and we all know that we have a different role in the academe. So I hope that had a I had a good explanation when it comes to Dreyfus model, and that was what I can also share on my part as someone who has lasted for 10 years in the industry now.